Good morning, and thank you for joining us this morning. I'm Melanie Brown, the Deputy Chief of Staff for External Affairs for the Governor and Lieutenant Governor's teams. First, let me start by thanking you for your leadership and partnership as together we respond to the COVID-19 emergency. While we continue to keep people safe, we also turn our attention to preparing for the vaccination phase of this COVID-19 event. So today we will hear from state leaders who are point on the vaccination effort. All three represent the three major intersections of this effort across state government. First, we'll hear from the state's chief medical officer, then the state budget director, and the state chief operating officer. So with that, let's get on with hearing our updates. First, you all know Dr. Jonae Caldoun, our Chief Medical Executive and Chief Deputy Director for Health and Human Services. Dr. Caldoun is in these roles. Dr. Caldoun provides medical guidance for the state of Michigan and oversees the public health, medical services, aging and adult services, and behavioral health and developmental disabilities administrations. Prior to her roles with the State Department of Health, she was the Director and Health Officer for the Detroit Health Department, where she oversaw a robust, community-driven community health assessment, established a comprehensive reproductive health network, and led Detroit's response to the hepatitis A outbreak. In 2018, she was selected for the 40 Under 40 Leaders in Minority Health Award by the National Minority Quality Forum, and she also is a fellow of the American College of Emergency Physicians. Thank you, Dr. Jonae Caldoun, for joining us this morning. I'll give it to you to take away.
Thank you so much, Mel, and good morning, everyone. Really excited to give an update on our vaccination efforts today. So 2020, as you all know, has been a very rough year with COVID-19 ravaging our communities, infecting over 400,000 people and killing, unfortunately, over 10,000 people, I believe we'll probably announce today. It's had a devastating impact not only on the health of our communities, but also on the economy. But I'm encouraged. Vaccines are on the horizon, and it will be here as early as next week. We now clearly know that there will be an end to this pandemic, and that while the next couple of months, with the holidays and it getting colder and people coming inside, the next couple of months will be hard. But by next spring, I expect cases to be dropping, vaccines to be getting more and more distributed in the community, and we will be able to fight this virus back. The availability of a vaccine and making sure we effectively get it distributed is the most important thing we can do to end this pandemic. And if we do it well, next year's winter and holiday season will look very different than it will this year. So next slide, what do we need to do? In order for us to get mostly back to normal, we need to get this vaccine out as broadly as possible. A lot of people have talked about this concept of herd immunity and needing at least 65% of a population to be immune for a disease to really get under control. While there's, again, still much to be learned about this virus, and we expect more and more vaccines to become available in the upcoming year, our goal at this point is to vaccinate at least 70% of the adult population in 2021. There's no question this will be a massive undertaking, perhaps the most massive vaccination effort in 100 years. But it's necessary, and we, as at the state level, working with many partners, many of you on the line today, we are going to do what it takes to make this happen. So there's a very robust approval process for vaccines in the United States, one that assures that the vaccine is safe and effective. And to be clear, while the process has been condensed for the approval process of a COVID vaccine, no steps have been skipped in the process. So essentially, these vaccines move through 3 phases of development to determine if the vaccine generates an immune response, to determine if it is safe, what the proper dose is, how the vaccine is best shipped and packaged, and then it progresses into phase 3 clinical trials, where you essentially compare tens of thousands of patients who receive the vaccine versus those who don't. And you look for efficacy and safety, of course. When the data is robust enough, a manufacturer then submits the vaccine to the FDA for approval. The FDA then reviews it, as well as an independent body of medical experts and scientists called the Advisory Committee on Immunization Practices. They review all the data and they determine whether the vaccine should actually be distributed and to whom based on the data that they have reviewed. So the vaccines will be available in very limited amounts in the beginning. And so the vaccine distribution will have to roll out in phases. The principles that we are using, again, this is based on CDC and other, the ACIP group I just talked about. The principle is to protect critical infrastructure to society and to protect the most vulnerable in the beginning when we do have a very limited amount of this vaccine available. Initial vaccines will be allocated to healthcare providers. This will be followed by essential workers, and then those who are at highest risk for severe illness, like those who are over age 65 and those who have high-risk medical conditions. And then eventually, you can see the vaccine will be available for the general public. It's important to note that the speed and availability of the vaccine all depends on the federal government, how they allocate the vaccine, and the manufacturer, how quickly they can actually manufacture the vaccine and get it out to the states. This next slide shows how we expect the vaccine phases to actually roll out. We hope that actually as early as next week, we will begin to start vaccinating for that phase 1A population that you saw on that slide. Again, that's healthcare providers and long-term care. Again, that will be followed by essential workers and those high-risk populations. What you can see here is that the phases will overlap some. Phases can actually start, the next phase can actually start while other phases are still ongoing. And again, all of this depends on the speed and availability of vaccine manufacturing and how it is allocated to the state at the federal level. So right now, I know a lot of you have heard about these two vaccines that are essentially in the late stages of the approval process and could potentially even be available for distribution later this month, which is very exciting. So the Pfizer vaccine was submitted for emergency use authorization on November 20th. This particular vaccine is challenging when it comes to distribution and storage logistics, specifically because it has to be stored at ultra cold temperatures, about -70 degrees Celsius actually. It's also shipped in pallets where of 975 vials, so a little under 1,000 vials at one time. And so that means that any entity that accepts this Pfizer vaccine will have to be able to manage that amount of vaccine and to be able to distribute it out quickly, and also to be able to store it with these ultra cold freezers that can keep it at that particular temperature. We do expect this Pfizer vaccine to be potentially approved for distribution as early as next week, and tentatively that date could even be December 15th. Once that is done, once it's approved, we know that initial allocations will go to hospitals, and we know where those are across the state that have those ultra cold freezers. We will then, moving forward, utilize this Pfizer vaccine in our federal long-term care pharmacy program, which will be responsible for vaccinating residents and staff in long-term care facilities, as well as distributing this vaccine to our local health departments who can handle it. The other vaccine that you see on this slide is the Moderna vaccine, which actually the manufacturer submitted its application to the FDA on November 30th. We expect it to potentially be approved about a week after the Pfizer vaccine. This vaccine, again, like all vaccines, has very specific refrigeration and storage requirements, but it does not actually have to be stored at those ultra cold temperatures like the Pfizer vaccine. And it also is going to be shipped in smaller allocations, about 100. So it makes the distribution logistics of the Moderna vaccine much easier than Pfizer. We are going to use this Moderna vaccine for those 1A populations as well, healthcare workers, smaller hospitals, and those in outpatient settings who potentially may not be able to handle the Pfizer vaccine, but they can handle Moderna. And again, we expect Moderna to roll out just a week after the Pfizer vaccine. Of course, all of this means pending approval. details of specific amounts of vaccine in both the first allocation of both of these vaccines and ongoing allocations, unfortunately, is still not concrete at this moment. All of that depends on what the federal government tells us, and it depends on the manufacturer. We expect to get that final information in the next week, and we will be working especially with our hospitals to finalize those distribution details over the next week. So there will be several important aspects of vaccine distribution that need to be addressed. As I discussed, storage and management of vaccines will be incredibly important. And ensuring also, because we're in the middle of a pandemic, that there's appropriate social distancing at any vaccination events. We've learned some of this through our testing strategy throughout this pandemic. What's also going to be important as we vaccinate large segments of the population. We also have to make sure that vaccines are tracked and monitored appropriately, and of course, making sure we're providing information on the vaccines to the public so that people are well informed on the data, the safety and efficacy of any vaccines, and also importantly that they will want to receive it. So all of that logistics and communication and tracking is going to be incredibly important throughout all of these phases. So this next slide, essentially, this will be a massive undertaking, and many partners will be involved here. They will support storage, they will support vaccination, and also administration, literally putting shots in arms. We have hospitals who will be primarily responsible for vaccinating their own workers, as well as supporting vaccination efforts in the community. Our pharmacies, as I said earlier, will be primarily responsible for vaccinating long-term care facilities, and then eventually will roll out to the general public when they are able to get the vaccine. We're also partnering with EMS, local health departments, the Michigan National Guard, and outpatient clinics. And again, this will be a massive undertaking. So my final slide, the bottom line is, this is the path forward to ending this pandemic. We're still learning, things are still evolving, and we at MDHHS and with many other state partners will be continuing to engage multiple stakeholders and the general public to make sure you have the information that you need to understand how to distribute the vaccine, if that is your role, but also the general public who needs to have information so that they can make decisions, and I hope the decision to get the vaccine themselves. You can find the most up-to-date information on our website that's listed here. Again, we'll be updating this frequently as more and more vaccine becomes available. And finally, I'll just say the vaccine is right here. We'll potentially be distributing it even this month. But still, it still means that we will need to be doing those basic things we've been talking about throughout this pandemic, wearing the mask, washing hands, maintaining and doing that social distancing. It won't be within 2 weeks where we'll be able to do away with all of those things, but we're right there. And if we can all continue to keep our guard and do those things, we'll be able to get a handle on this vaccine. And I am hopeful, pretty certain actually, that 2021 will be a better year. So thank you very much. And Mel, I'll turn it back over to you.
Super, thanks, Dr. J. Isn't she great? Now everybody sees why she's the state's top doc. Next we will hear from State Budget Director Chris Kolb. Director Kolb is responsible for coordinating all aspects of the state's $57 billion budget and oversees the Center for Educational Performance and Information, the Office of Financial Management, and the Sigma Support Organization. Prior to serving in the State Budget Office, Director Kolb was the president of the Michigan Environmental Council for 10 years, and he also served as a state rep in the Michigan House from 2001 through 2006, where he spent 2 terms on the House Appropriations Committee. Take it away, Chris.
Thank you, Mel. And I think I'm going to try to drive my own slide deck, which is always dangerous, but it's 9 in the morning, so I should be able to handle it. Building off of what Dr. J just talked about, Michigan, has, some really important tasks in front of us, directly related to COVID-19 and the vaccine distribution. And so we want to make sure we have the funds for that. At the end of every legislative session, there's always a lame duck supplemental. This year, we are stressing very, importantly to the legislature that we believe due to the uncertainty around revenues, action in DC, that we really need to be laser focused into our efforts to combat COVID-19. So our supplemental, request that we just presented for to the legislature last Thursday is really highly focused around making sure we have funds for critical COVID-19 response costs, and also so that we can do a economic stimulus to help individuals and small businesses who have been impacted by the virus. So the supplemental request would provide necessary funding to help people and businesses across the state who have been most affected by COVID-19. Want to address the ongoing cost to fight COVID-19, including statewide testing and contact tracing. And as Dr. J talked about, we need to begin this massive undertaking of distributing the vaccine and administering it across the state of Michigan. And we want to also support food benefits and that the federal dollars that we got earlier this year have to be used currently by December 30th. So there's really, those funds are not available right now to be used after the first of the year. And so we want to make sure that we have the funds necessary to really do two things. One, as I said, to be able to meet the critical needs for COVID-19 response here in Michigan. And then two, to really help out our families and businesses who have been impacted. So in addition to that $300 million supplemental request, the governor has also for a $100 million economic stimulus response. In Michigan, we are proposing that half of that funding be provided to families who have been hardest hit by the pandemic, and the other half of the funding would go to small businesses who are really struggling to deal with the emergency health safety requirements that are in place to really protect the public. We are open to negotiating with the legislature as to the exact mechanisms, but we believe that we need to move forward quickly so that we can respond to the needs of the people and the businesses here in Michigan. So in that, the COVID response supplemental, it's a $300 million supplemental plus the $100 million for the stimulus package. We are recommending the following cost to address COVID-19 in Michigan: $68 million for testing and efforts to limit COVID-19 in our prison system, $41 million continued testing across the state of Michigan, including in our county jails and adult foster care facilities. We want to continue the $2 wage increase for at a cost of $40 million. We then want to spend another $25 million for wastewater surveillance for COVID-19, which is a really effective tool to detect COVID-19 for outbreaks in facilities. So we can look at the outflow location of an outbreak, and then $15 million for PPE, antigen tests, and other medical supplies, and then an $11 million with staffing for hospital surge and additional costs. We know the number one need for hospitals in our medical field is staffing right now, and so these dollars would help to address that. And then another $11 million for nursing home response teams, COVID care and response centers, and special behavioral health units as well. The other COVID costs that we are looking for, as we talked about, engage in the largest, most massive vaccine in our history. So we're asking for $72 million to help fund that effort. A lot of that going to the Michigan National Guard for their support, staffing for local public health, and some administrative costs as well. And then we're also asking to use $419 million of federal funds for our SNAP benefits, which are targeted for children who receive free year's price meals at school, who would get those at school, but right now, because of COVID-19, they are at home. And then $10 million for additional childcare for children during school hours who are at home but need to be on virtual schools there. And those will help parents who are working, but children have to be home. And how are we going to pay for all this? Well, we have said for a long time that we are dealing with a lot of uncertainty to revenues here in Michigan. And while the FY21 budget still faces a lot of uncertainty, we have identified about $400 million of funds that would be used for the supplemental request. And second, $116 million will come from lapsed funding from departments from the past fiscal year. And then our Medicaid has not gone up as dramatically as we expected. So we have another $260 million of lapsed caseload funding there. We continue to see higher revenue collections in fiscal year 20. This is beyond what we expected when we did the August revenue estimating conference. So that's another source of funds. And then lastly, these costs can be shifted to future federal funds if Congress does pass a stimulus package. But Michigan cannot wait for Congress to act. There's just so much uncertainty in DC right now. And so we believe that we need to have the funds available here in Michigan to meet our critical COVID-19 response costs and to also help out our individuals and families and small businesses who have been impacted by COVID-19. So we are eagerly awaiting to negotiate with the legislature to address these needs in the coming days and the last 2 weeks of session. And with that, all right.
Super. Thanks so much, Director Kolb, and thanks for being our money man, always maximizing every cent we have towards this very valiant effort. Next, we have Chief Operating Officer Trish Foster. Trish is the administration's Chief Operating Officer, where she is conductor of an administration-wide orchestra of the intersections of state departments, agencies, is point on the governor's cabinet affairs, and even more importantly, she's expert in the coordination and logistics of the state's COVID-19 response. Foster is the former director of Michigan's Department of Technology Management and Budget, where she directed a staff of nearly 3,000 employees who provide business information technology, procurement, retirement, financial, and other administrative services for state government, and overseeing the department's $1.3 billion budget. Prior to this, she spent 23 years as Senior Managing Director and Chief Operating Officer of CBRE Martin and CBRE Grand Rapids. Trish, take it away.
Thank you so much for that. I appreciate it. I don't have any fancy slides, so you guys just get to listen to me, right? Because I would consider operations the muscle of the overall battle against COVID. It's a game of inches, and that's one thing that we have come to appreciate since the onset in March and April. And what I will say is everything that we've teed up since the beginning of COVID is helping to continue to position us in the best possible way to distribute vaccines going forward. And so what I really mean about that is the goals and objectives of the team have remained the same. Align with public-private partnerships so that we can spread the wealth and the need for products, for populations, for policy, for pronouncements with how we communicate across the state in ways that will be heard, valued, and achieved as it relates to our ground game. We didn't want to run out of PPE. That was a goal. Not running out of PPE is a goal for today too. So we have a stockpile of 60 to 90 days supply. We wanted to improve tests. When we started testing in April, we were testing 3,600 folks. We then pushed to 15,000, and then our new goal was 30,000. Nobody thought we could achieve that. Consistently, we're above 50 to 60,000 tests per day. We wanted to test 2% of the population in every single community, rural or urban, and we're now above 4%. We wanted to make sure that we didn't overwhelm our health systems, that they had staffing, that they had supplies, and that their surge plans could accommodate the overwhelming need within the communities. We're doing all of that. Establishing our P-Leads group, which still meets on a daily basis to tackle these ongoing issues, allows us to get ourselves in position, both logistically and with augmented resources with our friends in the hospital, long-term care, our local health departments, and anybody else who may have signed up to be a vaccinator. It puts us in the best possible position. You know, diversifying and running a ground game is super important. So we've got multiple testing streams throughout the state. Used to be we just had a PCR test. Now there are 6 antigen tests with emergency authorization uses that are available. We have 3 of those right here in Michigan, and we're bullish on getting more. We hope to bring 1.4 million more antigen tests right here to Michigan by January 31st. Those are those rapid tests for people who might not know. And we continue to work with our partners in the private sector who may need to help us with PPE going forward. Our partners in the federal sector, FEMA, HHS, we need more things, we need more supplies, and we need your help bulldozing through the red tape. The most important thing that I can say right now is that the team is solid, the team is consistent, uncertainty is the name of the game, but we're certain that together we will be able to move forward, work together with our healthcare providers, our long-term health, DHHS, and everyone out there who might be listening who has a supply, a product, or a person that can help us implement this throughout the state. And ultimately, we need each of you to be willing, able, and ready to receive a vaccine when your time is right. Thank you, Mel.
Perfect. Thanks so much, Director Foster. Now you all see why, with COO Foster at the helm of operations activities, we've been so successful as a state in acquiring the resources needed in the midst of this international pandemic. Well, we're on the 9:30 hour, so we won't keep you any longer, but thank you for joining us today for this COVID-19 vaccination briefing. We will do additional briefings throughout the coming weeks and months as we continue through this effort to keep Michigan folks safe. In the meantime, feel free to reach out to anyone in the administration, either on this call or in the governor's office with your additional inquiries as you have been. We look forward to seeing you very soon. In the meantime, thanks again for your leadership and partnership as we've gone through this year and as we've responded to the COVID-19 pandemic. Everyone be well, be safe, stay masked up, and happy holidays.
Thanks.